This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Nowadays, due to globalization and people's migration, nurses must take into account the cultural differences of patients while providing medical care. Therefore, cultural competence models are actively used in medicine to make nursing care efficient and effective. There are various types of these models, each of them has its peculiarities and differences. This paper will discuss the importance of cultural competency and the Leininger sunrise model applied to children. Advantages of the given model. Cultural competency is crucial in nursing care because it promotes respect and mutual understanding between patients and nurses, facilitates trust and cooperation, and helps patients feel more comfortable receiving medical care from nurses. Cultural competence models were introduced to allow nurses to build knowledge of various cultures that will help them overcome their bias towards patients of different backgrounds. For example, the Leininger sunrise model considers each culture to be a separate social structure that includes different philosophies, religions, values, and beliefs. This model examines not only cultural peculiarities, but also political, educational, and economic factors. Using this model, nurses conduct an analysis of all the elements and use their knowledge to provide medical care, taking into account values that are important for patients. Applying to children. Culturally competent care affects the vulnerable population in a positive way. Thus, the Leininger sunrise model applied to children teaches nurses how to achieve consent from infants of various cultures and establish productive communication with their parents. In addition, it helps to build contact with children and minimize their fears before any medical procedures. As a result, children are less stressed being in an unusual environment and feel more comfortable communicating with nurses. Conclusion. Therefore, cultural competence plays a significant role in providing patient care for a vulnerable population. It helps to establish contact and productive communication with patients, minimize their fears and stress, and facilitate their successful treatment. Moreover, it helps nurses to build knowledge of the cultural peculiarities of their patients and overcome their bias toward individuals of various cultures. Thus, it is highly recommended to use cultural competence models in nursing practice. This essay on Leininger sunrise model in nursing care was written and submitted by a student just like you. The Ivy Panda Samples database hosts thousands of works similar to this one on various subjects. Visit ivypanda.com to find what you are looking for, free of charge.